Hey, good day. How are you? My name is Thurman Rick Holliday. I am your Medicare plan expert, and I'm coming to you from our offices in Pasadena, California. And we are a small agency here, but we specialize in Medicare and individual health plans. I wanted to come to you because it's African American History Month or Black History Month, and I wanted to make something known to you that you may not necessarily be aware of. And that is that Medicare, yes, Medicare, 60 plus years old now, started in 1965, effective in 1966, actually changed how healthcare is received for African Americans in this country. One of the biggest changes ever. Most people aren't aware, but prior to Medicare's institution, hospitals did not have to accept people of differing races because they were the proprietary business. They controlled who came in and who left. They controlled who they served. And so that being the case, Medicare did not serve, and healthcare in general, rather, did not serve African Americans. You went to the Black hospital if you were Black. You went to any other hospital if you were non-Black. So with that in mind, what Medicare did is Medicare mandated that if you wanted to receive federal funds from Medicare, for accepting patients under Medicare, you had to accept all patients under Medicare, Black, white, brown, whatever. And so it changed the landscape. For the first time in the history of this country, African American people could go to the white only hospitals because they were on Medicare. It's kind of dumbfounding when you think about it because of the Hippocratic Oath, but that's how it was back in the day. And so that being said, I just wanted to say to those out there, when you think about if you're on Medicare, you're Medicare eligible, and you want to have access to services, think about what Medicare, and thank you, Lyndon B. Johnson, for instituting this and signing that bill that allowed us finally to be able to receive the care we needed. And why is that important? I follow a man who's on YouTube, Myron Golden. Myron Golden was a polio victim. He was only a polio victim because he was born in 1961, I believe, but he's only a polio victim because he was born in a Black hospital that did not have access to the vaccine for polio. The polio vaccine had been out for several years. He did not receive that vaccine. Therefore, he ended up having a polio diagnosis and lost the use of his leg. And now that wouldn't have happened had he been in a white hospital, born in a white hospital, seen at a white hospital. But because he was in a part of the country that did not allow African Americans to use their hospital servicing, he didn't have that option. Now, in a short moment, he'll be 65 years old, be able to qualify for Medicare, and guess what? He'll have access to all hospitals. He has that now, but he'll just have more access. So it's interesting how politics plays such an important role in what we do in our life in this country, but moreover, it is one of the key indicators of how healthcare has changed in this country for everyone in this country. So if you're a citizen, this is available to you. Right now, the political football has been kicked in the opposite direction where they're trying to say, if you're not a citizen but resident in this country, you do not have access to some benefits through Medicare. I think that's a shame, since it wasn't Medicare that instituted the ability for all people of color to be able to go to hospitals in the United States of America. Again, my name is Thurman Brick Holliday. I'm your Medicare plan expert, Pasadena, California. If you need anything with Medicare services, give us a call. You can reach us directly by dialing our office line at 626-542-7080, or you can always find us at trhinsurance.com. That's T as in Tom, R as in Richard, H as in Harry, insurance.com. Medicare, it's for you, it's for all of us. Take advantage.